A very good morning to all the viewers. Welcome to URON. And today we are here and we are having a very eminent and prominent urologist of all the time in India itself. So we are going to ask a few questions related to OAB to him. So before asking any questions, sir, I'd like to request to you to please introduce yourself with the viewers.
I am Anil. I am a urologist based at Meerut. I've been practicing urology since 1994 and have been fortunate to be the president of the North Zone and the UP chapter.
Sir, my first question related to overactive bladder. Can you please describe for the audience viewing this that what is an overactive bladder and how does it impact the quality of life of the patients?
Overactive bladder is a condition where the patient is unable to hold urine and has to rush to pass urine, and this occurs resulting in that he has to go more frequently to pass urine, and at times he is unable to hold and may even leak urine before he is able to relieve himself. And obviously it impacts the quality of life to a great extent because he is unable to go out. He becomes an introvert because each time he goes out, he or she would be under the stress of having to find a washroom and not having adequate amount of fluids, or curtail the diet also because the fear of a wet episode is always there. And it impacts their physical and mental health.
Correct, correct. Sir, next question which I would like to ask you. Why do you think that the patients with overactive bladder delay their visit to the healthcare specialist to get their condition checked out? Is it because they feel that this is not a significant condition to be diagnosed?
The primary reason I feel is that for a lot of people, they feel that it is part of life, especially for women. Women suffer as much OAB, probably even more than men, and their friends or relatives would say, oh, we have been living with it, it becomes like it's part of life, so you live with it, without realizing that it's a very treatable condition. And secondly, there is a stigma. Anything connected with the genitalia or the excretory tract, patients are little hesitant to talk within the family, and when they don't talk, they don't go to a healthcare specialist. If they got a heart condition or an eye problem, they say it very loud and clear, I've got a chest pain or I can't see well. But for something related to passing urine, they feel shy and they don't actually.
Yeah, they actually hesitate to
Yes.
discuss these topics. So, sir, my next question. What are the cons of delayed diagnosis? Can you please share us an example in your practice?
The cons are that the patient, as I said earlier, becomes an introvert. His quality of life deteriorates because he feels that wherever he'll go, he will make a social embarrassment of him by having a wet episode if he has, or even if he's say sitting in a room, he will be going to the washroom every few minutes. So, and everyone keeps noticing him, so it becomes, he tries to avoid going out. He becomes a social recluse, and then it starts playing on his mind and he becomes an introvert, depressed kind of person.
Yeah.
So there is a chain of events which occurs and he doesn't realize he's going downhill. And there are so many patients who, having suffered this for years, once they actually come and get treated by a specialist, they have a dramatic improvement in the quality of life, and then they wonder why the hell they waited so many years.
Thank you so much, sir,
Thank
for
you.
a wonderful time. You
Thank
have
you.
educated our viewers a lot.
Thank you.
Sir.
Thank you. Thank you.